guys, my name is Andrew. I'm Doctor of Physical Therapy over here at Odom Health and Wellness. I'm joined once again by Meghan. And so for those of you that remember, we did a video earlier this year sort of detailing what Meghan's priorities were in terms of running, her plans were amid COVID-19, how it's kind of been restricting what we can do, and how she's an ambassador with Twin Cities in Motion. And Meghan was dealing with a little bit of a back injury, so we kind of wanted to grab her and sort of give her a chance to share her story a little bit. And so at that point in time, when we last filmed this video, Meghan, you had some back discomfort you were dealing with. Would you mind sort of sharing sort of what that was like for you at that point in time? How was this affecting your life? How did that interface with running? Because I'm sure some people might be able to relate with perhaps where you were at.
Yeah, I was having a lot of pain, definitely with my everyday life. It definitely affected the way I went to work, and I could feel it in different movements that I was doing. But also, it took away one of my most favorite things, which was running, and that was really hard for me to take a step back and actually just not run at all, and that was really frustrating about my back. So
yeah, so kind of had this recreational, this outlet side that a lot of us like to tap into with running, but also just the day-to-day, it seemed like it was bothering you.
Yeah.
Super frustrating, right? I mean, I think, a lot of people find themselves in this situation, so you're not alone in that. What was it like sort of seeking out care for that? How did you reach the point of it's time for me to go get this thing looked at or to get it addressed?
I think when I had to take a couple days off of work, I had to take a leave of absence. It was time that this could get worse, so I have to really figure out a way. And what was really important to me was finding someone that could relate to running, and finding someone that was passionate about the sport like me, so I could get back sooner, and that was really important to me.
Awesome. Well, and that's how we kind of connected, right? Mm-hmm. So maybe what was the plan of attack? What do you think you responded best to throughout sort of your planned care and our treatment here and sort of the approach?
I definitely think the strength portion was really, really helpful for me, just strengthening those muscles around my back, so I was more confident so that I could return to run. And we worked right away into a return to run program, which was great because right off the get-go, just going and starting was really, really good.
Yeah, I feel like sometimes that's the key. It's not always this you need to stop running. It's sort of where on this continuum can you plug in, because it's not always stop running. Sometimes we need you to sort of maintain some sort of volume, right? And so you don't take steps backwards, especially at that point in time. We have races on the calendar. You have some things you're looking to plug into in terms of Twin Cities, and all those kinds of variables. So that was then, and so how have you been feeling now after going through kind of the treatment, and what does maybe the past couple weeks look like for you?
Well, oh my gosh, I'm so happy. This past weekend, actually, I ran 11 miles, which was something I never even thought I'd do 3 months ago. So it's been really cool getting back into running, back into my regular routine, and I'm really glad to be back to running.
Awesome. And that's something where, before we started, from what I remember, we couldn't even tolerate any sort of running, right? So to have that stark contrast, I think that's fantastic, and it sort of seems to unlock some options for you in the fall. So what is the fall going to look like for you, think, at this point?
Yeah, really excited. I think I'm going to sign up for that 10 mile with Twin Cities in Motion. I think it's a great distance. I know I can make it now, and I think when I really want to challenge myself is I can push my pace, and I'm just excited to kind of get involved with you guys in the virtual space and kind of rally together as a community.
Awesome. Well, thanks for sharing, Meghan. I mean, it's such an inspiring story, and if you're a runner and you might be on the other end of this video, just know that there are options, right? You don't have to kind of settle for sort of ceasing running, or maybe even feeling a little hopeless at times, right? I mean, I just know that there are things that are available to you in terms of treatment to get you back on the road training. So, Meghan, it's been a blast working with you. Hopefully this video finds all of you guys well. Otherwise, we look forward to plugging into these virtual and eventual, hopefully physical in-person races. Until then, happy running, and we'll talk soon.